Well, the first thing I'll say is don't be afraid of social media. It is not the evil thing that's ruining your children's lives, okay? We often hear that from parents saying, if it wasn't for Facebook and Twitter, my child wouldn't be cyberbullied. They were bullied I was bullied at school. The biggest difference now is it's 24 hours a day and it happens in their bedrooms. It happens when they don't even know about it. It's being spread amongst people that they aren't even aware of. So they're the same pressures that we faced when we were kids. They're just happening in different ways. So from our perspective, the biggest presenters to Headspace, the things that kids are coming to see us about, are things around drug and alcohol issues, major factors, and they cause a whole range of mental health issues. They're either contributing factors or they're secondary or tertiary factors. Issues around self-esteem, so that could be body image, it could be just resilience, it could be not knowing where they fit in life. Depression is huge. Bullying is amongst girls in particular, is enormous, and just on body image is not a female issue. It's an issue particularly for young men in that 16, 17-year-old age bracket who are typically, quite active in sport, quite athletic and wanting to be high achievers. It's a significant issue amongst young men. These are the major factors that young people are presenting with, but these are not new things. It's just that we talk about it a little bit more and we have services that young people can now access more easily. The issue around social media, there's been a lot of hysteria in mainstream media of late, and I'm sure some of my colleagues here will be able to comment on it as well, about it being the source of all evil and the cause of the ills of our society. You have to understand that young people communicate in a very different way than what we did when, 10, 15, 20 years ago, 30 years ago. There was a lot more face-to-face stuff. There was a lot more... we didn't have mobile phones. We weren't able to access the internet on our mobile phones. We weren't able to have conversations without actually speaking. And it's a different way of communication, but don't be afraid of it. One of the things I'm really frustrated with some of my friends who have got kids the same age as mine or a little bit older is none of them are on Facebook, none of them are on Twitter, none of them understand social media because it's not part of their life. I'm on, because of my job, I have to do that, but I would still want to be on that regardless because I need to know, not looking at what my kids are doing, I certainly wouldn't recommend that at all. I do have friends who are on Facebook to spy on their kids. That's not a good outcome. But it's like listening to the music that young people are listening to now. It's about understanding what space they're in, what culture they're in, and it's only then that you can actually understand the pressures they're going through. So if none of you are actually in that space, I'd highly recommend that you actually engage yourself there because that's where your kids are. That's where the conversations are happening. And you need to know not what the conversations are, but how they're having those conversations and how they're interacting.
Totally support that absolutely. I think also... One thing I'll say is even if you do friend them on Facebook, they frequently have two Facebook pages. One for the one that mum and dad are friends with. I would totally support it. Social media is just the way that they are communicating these days. It's their language, and if we don't speak their language, then how can we hope to bridge the gaps and to allow communication? So definitely learn their language, and if you need help, ask them. So if you have concerns with the social media or aspects of it, ask them directly and explain to them what your concerns are, rather than perhaps some reactions that I've heard, where people kind of prohibit something. Well, my feeling is that's not going to work. Ask them explain to them what your concerns are and ask them to explain to you how it works. Get them to teach you or even set up your profiles. Get involved. I think it's a fantastic way of learning how this new communication tool works. The other thing I would comment on around social media is it's the way these younger people are supporting each other. The way we support and our support networks have evolved over years, and these are different pressures that our young people face, and this is the support networks they're choosing and that are evolving now through time. And I think it's really interesting to sort of watch and reflect on that, and reflect on the support networks we were used to when we were their age, and perhaps what our parents were used to in times of crisis and in wars. There were more family connections and closer family connections, and perhaps arguably tighter communities. these are new community connections. These is a new way for young people that are actually working through, I think, to support each other. So I think it can be very powerful. You know, and the values you instill in your children are what protects them when they come into these new methods.
I echo Elizabeth's comment about the issues are no different than what we faced as teenagers, and I remember my first Reach experience. Reach run these large, they call them Heroes Days, and they bring in about 100 or 500 Year 9 students, often from 1 or 2 schools together. And over the course of the day, the kids get to sort of stand up and talk about, you know, what's going on for them and what might be the issues they're facing. And every time I go, I'm always amazed to sit in that room and go, oh, it just feels like being a teenager all over again. I can't believe that, you know, a lot of years later, you know, here are teenagers talking about those exact same feelings, that I don't fit in, I don't belong, people pick on me, you know, I don't feel like I'm good enough, why is life so unfair? They're all the things that we felt as teenagers, and probably a lot of the things some of us still carry today. So I would just echo the issues really are not that different. I think what is really interesting though is what we're coming to understand about the risks. And one of the risks that we're coming to understand better is how our brains and our bodies work. So researchers over the last few years have found that there's actually a gene in our body called 5-HTT-LPR. And you either have a short version or a long version of this gene. Not a researcher, just an enthusiast. But what happens is if you have the short version of this gene, and the estimates is more than half of us do, what happens is if you're put in a stressful situation, that gene then gets activated, and that's what leads to depression, because this gene deprives our brain of some of the things that give us resilience. And so understanding that then becomes really important about the preventative and the early intervention to try and stop those things being triggered by our environment. And the way that we're finding that we can reduce those risks for our kids is trying to reduce the number of stressful experiences, not always easy to do, but making sure that they've got a supportive confidant. So be they a friend or somebody close to them. If they don't, being able to access services like Headspace, where you can talk to a psychologist, or Lifeline is another way to do it. Having a supportive family environment. So to your point about having the values and raising them, trying to sit down at the dinner table if you can regularly, knowing that they're in a place where they're safe and they're loved really helps. And the other piece is trying to dial up some of the positive experiences that are happening in their life. And what positivity does is it builds us up socially, physically, intellectually, psychologically, so that when those tough times hit, as they do in all of our lives every now and again, we've got that resilience to be able to keep leaning in rather than leaning back.
Once again, I find myself echoing all of the comments from my colleagues here. I just wanted to talk just briefly about. I mentioned that 8% of calls to Lifeline's 13, 11, 14 crisis line are from youth, 24 years or younger, and we actually collect information about what their particular caller issue is about, and you know they do very much echo what Elizabeth was saying in terms of key issues, but. The main concern from young people is their own mental health, concerns about their own mental health, which can have a number of underlying factors attributed to it. Relationship challenges, non-family, is the second biggest issue that young people call Lifeline about. Sexual assault and abuse is the third most common issue that young people call us about. Self-confidence and esteem, confidence, life direction and spirituality, loneliness, future vocational and personal reasons, sexuality issues. We tend to, about 10% of calls from young men are related to their own sexuality, as opposed to 3% of calls from young women. So men seem to be utilising this service more openly to talk about sexuality. Alcohol and drug issues, child abuse, domestic and family violence, and bullying and harassment. So they're the key issues that we've identified that young people are calling us about. Just on the online crisis support, which we're currently undertaking a trial and we finish in August, we've found that 60% of our contacts are from from young people aged between 15 and 24 and 15 and 19. Main concerns are, concerns about their own mental wellness or an emotional problem that they've identified. Very interestingly, over 50% of contacts on our online crisis support have thought about suicide that day, so 1 in 2. So it seems to be a particularly more effective help-seeking medium for people to talk more openly about difficult issues like suicide, relationship problems, abuse, violence, and similar themes to what I've discussed before. That's a very very much based on the statistics to our service about what is worrying young people, and I would certainly support everything else that was discussed.